Okay, so I'm going to talk about infertility. First of all, don't panic from the scheme. First sight, you will be afraid, but I will use this scheme to make you remind all the things I'm going to say. Okay, let's just start with the subject, which is infertility. What is infertility? Infertility is inability to conceive after 1 to 2 years of regular unprotected sexual intercourse. So, what does it mean to have unprotected sexual intercourse? It means that there is no a method of contraception during this period. So it is an inability to conceive after 1 to 2 years of regular unprotected sexual intercourse. So it should be 1 to 2 years. It should be regular intercourse with an average of 2 to 3 times every 2 to 3 times, and it should be unprotected with any contraception. Okay, this is definition of infertility. So what are the types of infertility? We have two types: the primary and the secondary infertility. The primary infertility means that the couple is failing to is failing to have any child. Okay, so they have never had any child. Okay, but secondary infertility means that the mother has previously been pregnant. Okay, so regardless the result of the previous pregnancy, but the important thing here is that the mother has previously been pregnant. So we have a primary and secondary infertility. Okay, let's now move to what we call the chances of conception. So what are the chances of conception in the first year within 1 year of unprotected regular intercourse? 85% of uh, people will have a pregnancy in the first year. Okay, within 1 year. Half of the rest will conceive in the second year. Okay, so 85 will conceive in the first year. The remains 15%, half of them will conceive in the second year, with an average overall percentage of 90% of people will conceive within 2 years. Okay, but there are something should be there to make this percentage. The age of the mother should be below 40. Okay, and regular unprotected with no contraception sexual intercourse should be there too. Okay, so they will conceive with a percentage of 85 within 1 year, and half of them will conceive in the second year if the age was below 40 and there was regular unprotected sexual intercourse with a good frequency. Okay, these are the chances of conception. Now let's move to the causes of infertility. Oh, before we move to the causes of infertility, let's just talk about the factors affecting fertility. What are the factors that affecting fertility in our life? First of all, the frequency and timing of sexual intercourse. Okay, the statistics say that if the couple have a sexual intercourse 1 time per week, their possibility of conceive is 17%. But if they have sexual intercourse every 2 to 3 days, the percentage or the possibility of having pregnancy will be 50%. Okay, so one time per week 17%, and 2 to 3 times or every 2 to 3 days is associated with 50% percentage. So the best frequency of sexual intercourse to get conceived is 2 to 3 times per week or every 2 to 3 days. Okay. What about the body mass index? How can the body mass index affect pregnancy? More than 30 body mass index will cost the mother longer time to conceive. So one of the methods of treatment of the infertility is to decrease the body mass index. Okay, so this is about obesity. What about decreased weight? Below 19 body mass index is associated with irregular cycle, which in its turn will affect fertility. Okay, so below 19 and above 30 is a risk factors or predisposing factors for infertility. Okay, so first of all, frequency. Second, body mass index. The third thing is over-counter drugs. Some over-the-counter drugs will affect infertility or fertility in a way or another. Okay, smoking. Smoking is a very important factor that is strongly associated with infertility in both male and female. Okay, so a male or a female smoker will have less ratios of having child. Okay, occupation 2. Tight underwear. Tight underwear is associated with increased scrotal temperature, and increased scrotal temperature is associated with decreased semen quality and infertility in its turn. Okay, so frequency, we should have every 2 to 3 days sexual intercourse. Body mass index below 19 and over 30. Over-the-counter drugs, smoking, occupation, and tight underwear. All these factors are disposing factors for infertility. Okay, let's now move to the causes. Of infertility. So what are the causes of infertility? Female factors constitute about 45 to 55% of all causes of infertility. Okay, so female factor is the most important among all causes of infertility. What are the female factors that affect fertility? The ovulatory functions in the first place. Okay, and its function of the ovulatory functions will lead to infertility with the higher rate for ovulatory functions. Okay, then tubal dysfunctions. Okay, tubal dysfunctions, and after that uterine. So first of all, ovulatory functions, tubal functions, and uterine functions are in order responsible for 45 to 55% of infertility. After female factor, male factor with 35% will affect fertility. Okay, and after male factor, both male and female with a percentage of 10 to 80%. Okay, and 10% of all couples will have unexplained infertility. Okay, so female factors, male factors. Okay, secondly, male and female factors, 3, and unexplained with number 4. Okay, these are the causes of infertility. Let's now move to the basic workup for infertility. What investigations or what things we should do for a couple that comes to us with infertility. First of all, when to do this basic workup, we have to do this basic workup with to infertile couple. Okay, a woman failed to conceive after 1 to 2 years of unprotected vaginal sex in the absence of infertility causes, as we mentioned before. Okay, artificial insemination after 6 failed trials also should be investigated, the basic workup for infertility. Okay, the question now is when to check or to do this basic workup earlier. When to do it earlier. Okay, if the female was of an age above 35. Okay, because with increasing age the chances of getting pregnant will decrease. So in patients above 35 years old, they have to check the infertility earlier to have better chances to get pregnant. Okay, the second thing is know if they have known cause of infertility, whether it was male or female causes. Okay, if they have known cause of infertility, they have to check earlier. A planned treatment that may affect fertility. Okay, for example, chemo or radiotherapy that are done for cancer patients that may affect fertility. Okay, so if we have a patient that will go under chemo or radiotherapy and they would like to conceive, we have to plan pregnancy before undergoing the chemo or radiotherapy, so they have to check earlier. Chronic viral infections like HIV and hepatitis B or C. Patients with these chronic viral infections should investigate for the infertility to do the what I wanted from there to get pregnant. Okay, so these points are when to check earlier for the basic workup of infertility. Now let's move to what are the basic things to do to infertile couple. We have to check for both male and female. Okay, first of all, we have to take a good history and physical examination. Okay, history and physical examination, as you know, is above all investigations, and the history and physical examination should be taken from both male and female. Okay, second, we have to do semen analysis. We have to start with the male factors. In semen analysis, we have to notice many things. First thing is the volume of the semen. The volume should be 1.5 milliliter, okay, or more. What about the concentration of the spermatozoa? The concentration should be 15 million per milliliter, okay, 15 million per milliliter. What about the number of spermatozoa? The number of spermatozoa should be 39 million per ejaculate. Okay, the concentration should be 15 million per milli, and the number of spermatozoa should be 39 milli per ejaculate. What about the motility? Motility, as you know, the sperms should be motile to reach the target, to reach the ovum. So the motility should be 40%. 40% of the sperms should be able to move to reach the ovum, or 32% with a progressive motility. Okay, 32% of the sperms with the ability to have a progressive motility is fair enough. Okay, what about vitality? 58 of sperms should be viable to have the good uh, quality of sperms. Okay, what about the morphology? 4% of the sperms should have a good morphology, a normal morphology, to be good. Okay, so this is semen analysis: volume, concentration, number, motility, vitality, and morphology. Okay, this is a male factor. Okay, what about females things? Females workup. We have to have evidences of ovulation. The first important evidence of ovulation is regular cycle. Okay, and mid-luteal progesterone. Okay, at day 21 in a 28 days cycle is also an evidence of ovulation. So regular cycle, mid-luteal progesterone, and day 2 or 3 FSH and LH. Day 2 and 3 FSH and LH. Okay, these are the evidences of ovulation. What also we should do as a basic workup for infertility: rubella investigation. Rubella is an important cause of infertility, so rubella investigation is important. Cervical smear, prolactin, hyperprolactinemia, as you know, is an important cause of amenorrhea or irregular cycle. So also prolactin is important to investigate infertility. Thyroid function test, rubella, cervical smear, prolactin, and the thyroid function test. Okay, what further investigations can we do to investigate infertility? Okay, the things that we mentioned, the semen analysis, histophysical examination, the evidences of ovulation, rubella, cervical smear, thyroid, and prolactin, is obligatory to all patients, but there are some specific investigations for specific cases. Okay, let's start with what we call ovarian reserve. Ovarian reserve is especially taken for over 35-year-old females because we suspect ovarian failure. Okay, we suspect ovarian failure. So how can we investigate ovarian reserve? We can investigate ovarian reserve by counting antral follicle count. Okay, counting antral follicles. How can we count antral follicle? By ultrasound. Okay, transvaginal ultrasound. Also, anti-Mullerian hormone is a good indicator of ovarian reserve. Okay, the anti-Mullerian hormone is secreted by granulosa cells, okay, from the ovary, and gives a good impression about ovarian reserve. If anti-Mullerian hormone was below 5.4, it would be low response and low reserve. If it was above 25, we can call it a high response or a good reserve, good ovarian reserve. Also, FSH is an important indicator. As you know, FSH, if ovaries was working well, it will make a negative feedback on the pituitary hypothalamic pituitary line, and will cause FSH negative feedback. Okay, so if we have less than 4 FSH, that indicates that we have a high response, a good response, because there's a lot of ovarian hormones that affect the FSH in a negative way to reduce it. So we have a high response if we have below 4 FSH. If we have above 9, we have low response because there is lack of FSH negative feedback. Okay, what also can we investigate? Tubal and uterine abnormalities. Okay, we have to investigate tubal and uterine abnormalities for any anomalies of the uterine septate, uterine and bicornuate uterus, or any other thing. Okay, so hysterosalpingography is a good way of investigating the tubes and the uterus. Okay, when do we use hysterosalpingography? Is after failed trials of anovulation induction, okay, or failed intrauterine insemination that we will mention in minutes. Okay, so we use hysterosalpingogram for these two cases: after failed trials of anovulation induction and after intrauterine insemination. The bad news that tubal and uterine hysterosalpingography needs a good experience. Okay, hysterosalpingo contrast ultrasound is an ultrasound, transvaginal ultrasound, with the contrast that is introduced into the uterus and the tubes via a catheter. Okay, this contrast is constitute air and D-galactose. Okay, air and D-galactose with ultrasound transvaginally. This method is less invasive than hysterosalpingography. Okay, so we use it before intrauterine insemination to make sure that everything is okay, and intrauterine insemination will go good. Okay, it is less invasive, but the bad news again that it needs even more experience than hysterosalpingography. So the further specifications that we use is ovarian reserve for patients that over 35 years, via intrafollicular count, anti-malarial hormone, low response below 5.4 and high response above 25, tubal and uterine abnormalities, hysterosalpingography that needs experience, hysterosalpingo contrast, transvaginal ultrasound, air and D-galactose that are good, that is good, but also needs even more experience. Okay, so this is a general talk about infertility. In the next video I'm going to talk about management of infertility. See you in the next video, and thank you for watching. Thank you.